is CGTN, China Global Television Network.
It is now over 2 months since the first COVID-19 case was reported on the African continent. And since then, the numbers have grown exponentially, reaching in excess of 51,000 confirmed infections as at this week. It goes without saying that COVID-19 has dealt the greatest blow in modern history to Africa's people and their economies, even as the global community rallies to fight back the novel coronavirus. And as the virus continues to take its toll on global health, economic pressure is mounting and becoming a crisis in and of itself. Now, governments are having to play a delicate balancing act between saving the livelihoods of their people and safeguarding public health. Recent weeks have seen key economies in Africa begin to relax restrictions on movement, but the COVID-19 curve is not yet flattened and a confirmed cure is neither in sight. So, is it time yet to reopen Africa's economies? And how does the continent's story compare with other regions of the world? I'm Beatrice Marshall. Welcome to Talk Africa. And to help us explore the medical angle in the reopening of Africa's economies, I'm joined via Skype by Professor Rodney Adam. He is a specialist in infectious diseases at the Aga Khan University Hospital here in Nairobi. Professor Adam, thank you for joining us on Talk Africa today. I want to start by getting your perspective on COVID-19 in Africa at this point, because it was expected to hit Africa the hardest given the gaps in public health infrastructure. But we haven't seen the same trajectory in Africa as we have seen in other parts of the world. China's Wuhan, the United States, the United Kingdom, Italy, or Spain. Many, though, are asking, how do you explain this to the wider public?
So that's a question that you will get a lot of opinions on. There has been a lot on social media and anything else about ideas. Some of those ideas are now disproven. There's no evidence for genetic differences, for example, and in fact, in the U.S., Black Americans have fared worse than white Americans. And why is that? Probably because their diseases like diabetes, heart disease are more associated with poverty than with wealth. So, so it looks different, but it's not a genetic difference. There's no good evidence that there's a geographic difference. And remember that the virus likes 37 degrees, so it spends the great majority of its time in humans and a brief period of time getting from one human to the next. So it's probably not the geography. Then the biggest single early factor was that the amount of transportation into the continent was just so much less than between Asia and Europe or Asia and North America, et cetera, so that it took longer for the first cases to be introduced into the continent. And then I think at least some countries, including Kenya, have made a very concerted effort to try to control it, much more than happened early in the curve with the US or most of Western Europe.
Right.
So I think that has played a role also.
Let me just pick up on your final comment where you said that the amount of foreign transportation into the continent was a little bit late, and African countries had probably taken measures to close the borders a little earlier on before the cases grew. Let's explore that a little bit better, because in terms of the preparedness and response of African countries, give us your perspective on that.
Well, in terms of preparedness and response, I have only experienced Kenya. So That's the only one where I have any firsthand understanding. And I know that the Ministry of Health has been very aggressively working with case finding, with trying to control infection. And I think the extent to which they have done that is far more than anything we have heard about from the West, from Europe and North America. In that way, it's perhaps closer to what Korea, Singapore have done. So that's one part of the preparation. Even for testing, we're not where we should be, but we're still way ahead of where the U.S. was a few weeks ago. And in fact, it was some of the regulations in the U.S. that slowed everything down in terms of testing. So that means that when you test, you can follow up cases in communities and be quicker to be on top of control.
Right, so let's look at that question of testing, because several countries, notably Kenya, South Africa, and even Ghana, when they began the mass testing, then we saw, a lot more cases being reported. However, many of these countries have already started easing their restrictions, like Kenya as well has begun easing restrictions. Do you think the gradual reopening of the economy at this point is premature, given the fact that the mass testing is showing a lot more infections?
That's a tough question that countries throughout the world have been debating, and even with the US, the 50 states probably have 50 different approaches. And I think we will only know months later what the best approach was. And the reason I'm saying that is because some countries have relaxed a bit earlier, and they've been criticized for a greater number of cases at that time. But we don't know what's going to happen months later, if they're ultimately going to have the same number of cases or not. So, and on the other side, there is a level of restriction in many countries right now that is not sustainable. And if you try to totally lock down everything here in Kenya and in Nairobi, people who are starving aren't going to care about the restrictions. They will go out and do something. So there's always going to be this tension between the need to keep the economy going and the need to control the infection. So I think there needs to be a very careful look at where the biggest value is in terms of restriction and how to encourage what needs to happen. And along with that, we are hearing about many people who are dying because they were afraid to come to the hospital and they haven't had their normal diseases treated. And we have to avoid that. There may have been a lot more deaths from that than from COVID itself. So where is the right balance?
So let's look at what's happening now in the region in terms of the rain season. Normally, the March to July is also a flu season in most of East Africa. Does this complicate, though, the fight against COVID-19? And what needs to be done in a situation such as this?
Well, the assumption is being made that climate will have a big impact on COVID. I'm not convinced that it will, and I think we'll only know we'll only know as we look back a couple of years, because it's probably here to stay with us. And if by flu you mean influenza, which is the closest virus to COVID, and in fact, COVID is compared a lot to the 1918 influenza pandemic. So if you're comparing to that, the seasonality is not very great in sub-Saharan Africa.
Right.
In the North America and Europe, you'll find that influenza peaks in December or January and is around for 2 or 3 months and then mostly gone. But here, it's present all year. Some parts of the year are a bit more than others, but there's not the same level of peak that there is in the north.
All right, so looking ahead though, Professor, based on the current infection rates in Africa, at least as we speak, over 50,000 infections, over 16,500 recoveries, over 1,900 deaths across the continent. How do you see this pandemic unfolding in Africa over the next few months?
Another really good question that everybody is trying to answer. And in fact, when we started seeing the first few cases here in Kenya, and then the first few local transmission cases, we were expecting the numbers to come up much faster than they did. I think that says a lot for the types of control that were already done. I know one of the questions that keeps coming up is trying to compare the expected severity between here and Europe or North America. So the things in our favor here in Kenya is that we have a younger population and fewer people have those major comorbidities such as heart disease, diabetes, kidney disease, chronic lung disease. That's less common than in Western Europe and less common than in the US or Canada. So maybe we are partially protected in that way. But it's likely that the cases will grow. What we're hearing from our neighbor to the south is that they are seeing lots of cases now. That's more from the informal side than from the formal side. So it's likely that it will be a big issue for us over the next few months. I don't see it going away that quickly.
And even as it becomes a big issue over the next few months, Professor, there is this emerging concern that we have seen, particularly around the East African countries, of cross-border transmission and infection rates, particularly with Kenya, Uganda, and Tanzania, coming from the truck drivers because, the food process has to continue. On the medical front, though, is there a regional integrated approach or communication to deal with this? Because every country is dealing with it using their own domestic policies.
In terms of cooperative efforts, there are the informal efforts. For example, with Aga Khan, we have conversations on a regular basis with our colleagues in Uganda and Tanzania. So there is that kind of interaction going on. But in terms of official, not so much that I'm aware of. In fact, as we commonly hear, Kenya and Tanzania have gone very different directions in terms of attempts for control right now. For the porous border, it's not just the trucks, it's people getting through from the less common ways, from Namanga and other parts of the border, and that's likely to continue.
All right, Professor Rodney Adam joining me there via Skype. Thank you very much for your insights. Professor Rodney Adam is a specialist in infectious diseases at the Aga Khan University here in Nairobi. We're going to take a short break now, but when we come back, we'll cross over to Southern Africa to further explore the reopening of Africa's economies in the wake of COVID-19. Do stay with us.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Welcome back to Talk Africa. Now, following what had been dubbed as one of the strictest lockdowns in the world, South Africa began easing restrictions on movement and business in May. Factories, mines and businesses in agriculture can now gradually resume operations with a third of their staff. People have also been conditionally allowed to leave their homes, and public transport is resuming, but with tough regulations. Well, Laura Lopez is joining us from Johannesburg via Skype. She's the Deputy Editor of Bekisisa Center for Health Journalism. Laura, thank you for joining in this discussion. And let's start off by looking at South Africa's position at the moment, because the country has begun easing restrictions there, public transportation and a bit of work. What public health safety assurances, though, are there to ensure that the situation is under control?
Yeah, I think that's a great question. So I think, I think what sort of drove the decision to ease the lockdown, which, as you mentioned, was very strict, is really epidemiological data. So the lockdown really bought us time. So before the lockdown happens, about a month ago, cases of COVID-19 are doubling every 2 days, and that infection curve is really quite steep. The lockdown happens, the curve flattens, we reduce the infections, and it pushed the peak of cases back. But what scientists found was that had we continued with the lockdown in its former iteration, it really wouldn't have bought us that much time. So I think that they took that data and then they weighed up the data of the very severe job losses, hunger, increased domestic violence, and I think those are kind of the factors that drove the decision to ease the lockdown. Going forward, we've been warned that outbreaks are going to happen, but we're hoping, I think, as a country that the testing that we're doing can identify outbreaks locally very quickly and let us respond, our health services respond rather.
So let's look at that testing capacity of South Africa, because you've been warned as a country that the outbreak might grow bigger, or the infections might be much more than what they are now. What is South Africa's testing capacity today, though? Because in early April, the Minister for Health, Dr. Zweli Mkhize, launched at least 67 testing units, which were deployed to districts across the country.
Right. So, we had been promised that at some point the country would scale up to do, almost like 30,000 COVID-19 tests a day. We're still much lower than that, but what we're sort of hovering around 10, 11,000 tests per day. And given what we're seeing with community transmission and the sort of low levels of infections we have going on, scientists are confident that that's enough in terms of testing. But we are certainly struggling, like everyone else, with reagents, with testing availability, and also shortages of protective gear.
So where are we seeing the infections spiking at the moment? Is it in the informal settlements? Is it in the urban centers? I mean, is South Africa able also to detect cases as they emerge? Where are we seeing the spike?
So what I think is really, really interesting is that we are drawing on some of the technology that we developed for HIV and TB to really try to map this epidemic. So South Africa has got 5 levels of lockdowns you can be in, 5 being the most sort of hardcore and sort of strictest one, and then 1 being, things are sort of returning to normal. These 5 levels can be implemented on a national, a state, and even a district level, and that's really using the sort of mapping and the geospatial sort of technology that we've developed with the fight against HIV. What we're seeing is that the large metros, Johannesburg, Cape Town, Durban, Port Elizabeth, East London, and the Eastern Cape, those are really the hotspots. So the Western Cape is by far leading with cases, and those are largely concentrated around Cape Town. We know that we're not picking up all the tests, so the kind of tests that we're not picking up all the cases rather. The sort of tests that you are being reported on every day are not all the infections. So I think it's going to be a challenge to kind of continue that surveillance, but I think the country is putting together and has already launched rather a national screening program, which is starting to pick up which is starting to pick up cases as well.
So many countries around the world and even in Africa, though, have been concerned about infections of their public health professionals. And South Africa, we understand, is now starting to issue the BCG vaccine to its healthcare workers. What is the government thinking behind this?
So I think that's a really interesting question. Right now, there's a very small trial in Cape Town, about 500 people, among healthcare workers that is administering the BCG. So the BCG is not being given to healthcare workers as a sort of national policy. The other thing I think to really note about that is this idea that the BCG can protect people from COVID-19 comes from a single study that was deeply flawed. So, it has a lot of flaws in how it was designed and the way it kind of interpreted data. But I think the biggest flaw in that study is that it took data from about, from January to about March 20th. And that's really before most of the world that really continues to rely on this vaccine had started seeing cases. So right now, the WHO says, there's no data to really support the BCG vaccine as something that can protect anyone from COVID-19, but there is a small 500-person study in Cape Town among healthcare workers.
So Laura, at the moment, South Africa has the highest number of cases in the Southern African region and in Sub-Saharan Africa, to start off with, though. But we do also understand that Lesotho doesn't have any cases at this point. How is the SADC region, though, managing the issue of cross-border transmission, given the different approaches of every country?
Yeah, I think that's a very good question. I think it's a bit hard to kind of get a sense of that right now. South Africa technically remains closed. The borders remain closed except for repatriation of people, going back to their home country. And we know that that's already caused some issues. For instance, we know that there are people from Lesotho who are stuck in South Africa now, who have been stuck here for so long. They're in need of, ARV refills. And because our country has a different ARV regimen than their country, there's having to be cross-border communication that way. But I think it's difficult to tell, but right now everyone's borders seem to be pretty shut, except for repatriating people home.
Well, so one other issue that is coming up is that even as Africa reports a milder regional impact compared to the rest of the world, we're also seeing a lot of African countries showing their level of preparedness. We're seeing countries, producing their own masks, ventilators, PPEs, and even a country like Madagascar coming up with a herbal tonic. Give us an assessment from the Southern African perspective, though, about the level of preparedness and the level of response from the region in dealing with the pandemic.
Well, I think first, just to sort of clarify, we've heard a lot made of the Madagascar tonic. It's derived from a plant that's sort of used, a derivative is sort of used in classic malaria treatment. I think it's really important to say that tonic is not proven. So it was tested in like 20 people. And Madagascar has approached South Africa for help to try to test that. Our health minister, Zweli Mkhize, has said that we have been approached, but we will only participate in scientific testing of that, and that's not where we are. So again, I think just some caution around sort of cures and unproven sort of treatments in a time when I think a lot of people are very desperate for something. The one thing I think is been really interesting to see is I think you're right. I think that South Africa and certainly countries across the continent have really taken firm, decisive, early action in contrast to countries like the United States. So I think that's been really amazing to watch. And I think that what you're seeing now is a lot of countries build on expertise with Ebola, with HIV, with TB. And so in some ways, I think that we are in a better position to sort of do that kind of like public health planning. And I think that right now it's really, people are preparing. We've got field hospitals going up. Certainly in South Africa, preparations have been made for in the eventuality or in the case that happens, mass burials. And certainly what the African Union is really urging everyone to do is to use this time before Africa sees a large uptake in cases to prepare health systems to get your testing up and going, to get those community screening programs going, to make sure that you have community quarantine sites if you need them. So I think that's where everyone is at right now, is just really preparing for peaks that are likely to come later.
So a lot of countries, Laura, have taken efforts to protect public health workers there, but also they have, enforced a lot of restrictions to protect the public as well. When it comes to the public, though, from what you can see, are the people now starting to comply with regulations, particularly since, this has been with the continent now since late February?
Yeah, I think it's interesting, and I think you're seeing interesting uses of mobile phone data. So Google has released some data about how people's movements in South Africa changed after the lockdown, and you certainly saw people were abiding. So shops emptied out, sort of like public places were empty. You've seen similar decreases in mobility in Nigeria, Tanzania, Ghana as their lockdowns happen. So I think people have complied. Certainly, if you go out in Joburg now, it's a rather empty city. People are socially distancing, and if you go to the bank or if you go to the shopping mall or the groceries, and you are seeing a lot of people wear masks. I think that the call to lift the lockdown was correct in the fact that I think that you would have lost a lot of public support had you continued lockdowns in the way that they had sort of been previously. So I think people are responding to it, and I think if you continue to provide people with information and they understand why they need to do things, I think people really become empowered and can take action.
All right, Laura, just a final comment from you, though, because you as a health expert here, I mean, in terms of journalistic expertise, and you've been watching what's happening across, the Southern African region in terms of numbers and the decisions governments are taking. When do you anticipate, or what is the feeling from South Africa? What is the feeling in terms of how the pandemic is evolving? When, for instance, do you expect, the normal to begin?
That's a very good question, and one that we've really been putting into scientists. So I think South Africa has a lot of modeling going on about what the epidemic looks like here in the future. And I think that regardless of who you are and which model you look at, it's clear that we see a very large peak of cases in July, August, or September. So that's a reality that we're gearing up for. And certainly these small outbreaks I've talked about before, I think the kind of consensus among experts, even internationally, is that life doesn't go back to normal until we have a vaccine. So this thing is here with us to stay, and I think it's about really trying to prepare for those small outbreaks and catching them at a very local level, and then again, trying to shut them down before they sort of out of control and overwhelm the health services. But life as we know it is not, I think, on the cards until that vaccine happens.
All right, Laura Lopez joining us there via Skype from Johannesburg. Thank you very much for your insights on the COVID-19 situation in Southern Africa. Well, that's all we have time for this week on the program. Thank you to our guests for their insights. Professor Rodney Adam earlier in the show, and Laura Lopez, she's the Deputy Editor of Bekisisa Center for Health Journalism. Remember to follow the conversation online through our Facebook and Twitter handles, and you can also watch the program on our website and the YouTube playlist. To join us again next week. From me, Beatrice Marshall, and the team in Nairobi, goodbye and stay safe.